Hi, my name is Sharon Frank. I'm a speech-language pathologist specializing in vocal cord dysfunction. I am also the creator of the P.I.E Approach, which is a holistic approach to treating this very complex disorder. I've made a few videos for you to look at. One video actually there are two videos that talk about the P or the physical part of the P.I.E approach. There's one video that talks about the intellectual or the cognitive aspect of it, and then there's one video that talks about the E or the emotional aspect of the P.I.E approach. I hope that you find these videos to be helpful and informative. There are two parts to the physical aspect of the P.I.E approach. This video talks about breathing. Most VCD patients, when they come to my office, they say that they feel short of breath, but they also say that they feel like they're out of shape. And they're really not out of shape. So their overall fitness level is really quite good, but their respiratory fitness level isn't quite lining up with their overall fitness level, as my colleague Kelly Cucci would say. In my experience, the patients that come to my office, they have enough oxygen. Even though they may feel like they don't have enough, they have enough oxygen in their body, but just because it's there doesn't mean it's getting to where it's got to go. Doesn't mean it's being dispersed throughout the body like it should be. And that would be the case of true hyperventilation. But what also could be happening, or instead, it could be that the person's breathing pattern is off. So maybe they're breathing from the wrong spot. Maybe they're breathing and holding their breath and not knowing it. Maybe they're stacking their breath. Maybe the breathing pattern is kind of staccato. It could be a combination of these things, and they may not be aware of it. But when you correct the breathing mechanics, then you end up getting more oxygen delivery throughout the body. You end up getting better use of the correct breathing muscles. And you also, when you do all this, you get a sense of better control and calmness. And that really works really nicely for patients because, usually they talk about not feeling in control. And they think it's a matter of when they're going to have a breathing problem, not if. So this really changes a lot of things and helps them feel like they're more in control of their breathing. So how do we correct these breathing habits? Well, I like to use the principles and some methods of Buteyko breathing. That's B-U-T-E-Y-K-O, Buteyko breathing. And the goal of Buteyko breathing is to normalize the breathing pattern and to optimize oxygenation throughout the body. It's really natural. I find that it's practical, and it's also very calming for the patient. It helps the patient learn how to breathe efficiently and appropriately for the task at hand. It's kind of like, what we're doing here is we're trying to reset the breathing. So if you think of it as the tripometer in your car, we're trying to set it back to 0, 0, 0 at rest. And then what I do is I take the patient from correct breathing habits and patterns at rest and take it all the way through exertion, through the maximum level of exertion in their sport. And it's been very, very helpful for these patients. Now, what you may want to do is also look at the next video, which talks about the second aspect of the physical part of the P.I.E approach, which has to do with manual therapy. You may want to look at that next. I hope this was helpful.